Well, thank you. Thanks to the NIF and to Yachad for organising this, and of course, very much thanks to Ghada from PHR and Beth from Gisha. I'm not going to sort of dwell at great length on even the recent history of Gaza, but just to do a, as it were, quick recap. About 2 million people, 140 square miles. The majority of people, the descendants of the population, are descendants of refugees from 1948. Many families from what is now southern Israel, but some from as far afield as Jaffa. So 2006, January, Hamas won elections throughout Palestine, or throughout the Gaza, West Bank, and East Jerusalem. Elections that were regarded as clean and fair by observers from the international community. Then coalition talks with Fatah broke down and in effect descended into a brief but pretty bloody civil war, after which left Gaza in charge, Hamas in charge of Gaza, and Fatah effectively, or the PLO, in charge of the West Bank. And since that moment, really, in June, July 2007, Israel for pretty well all the time, and Egypt for quite a big proportion of the time, have maintained a blockade on Gaza, which with very incremental variations has lasted until the present day. And I think it's just worth pointing out that that blockade, really lasting 13 years, and two, or actually three pretty devastating wars, two of which saw the deaths of thousands of Palestinians, many thousands of Palestinians, and a much lesser amount of Israelis, have failed to dislodge Hamas, but they have brought really pretty intolerable pressures on the population. We talk sometimes about the developing world. I've spoiled my punchline. But actually, I think of Gaza, and this isn't a terribly original point, as the de-developing world. When I first went to Gaza in 2003, when the Intifada was still very much underway, there were hundreds, if not thousands, of factories still working, particularly in the furniture and in the clothing sectors, supplying and getting there in many cases, supplying to Israel, with very good relationships actually between Gaza businessmen and Israeli businessmen, as well as to the West Bank and further afield. And that economy, which for all its terrible problems is vibrant, has been almost entirely hollowed out by the blockade. Actually, in 2011, consumer goods imports were somewhat eased into Gaza, and I expect rather Beth or both will talk about the effect of this in the medical context, but what is accepted from that are so-called dual-use items, some of which are, include some complex and pretty necessary electrical machinery and technological machinery, on the grounds that they could be subverted and usurped and used by Hamas, so-called dual-use items. But the hollowing out of the economy has had a really devastating effect. We're looking at, on the most conservative calculation, 47% unemployment in Gaza, with it much higher, over 60% for the under 25s. And this is a huge figure, even compared with all the problems that Gaza had, really from 2000 on, compared with what it was even as recently as 2006. I think one of the things that's most misunderstood about Gaza, and I have been going there for a long time, is its incredible resources, actually, if it were free to use them. And of course, there's the land, agricultural land, much of it actually on the border, and which at the moment farmers are often unable to go to, and the fishing grounds. But above all, really, it's people. And I suppose that, you know, it's almost a cliche, but I think, like a lot of cliches, it's true that the incredible resilience and often humor, actually, among Gazans is the thing that strikes anybody who spends any time there. And I think this is particularly true in the face of the suffering that's gone on in the last years. Gaza's population, even though children, I'm sad to say, are now often leaving school more than they used to, earlier than they need to, simply in order to try and scrape together some money from their families, Gaza is an extraordinarily well-educated population. There are 5 universities, and I'm always amazed by the number of students who work intensely for their degrees, despite the fact that graduate unemployment is probably higher than pretty well anywhere else in the world. I think that education goes hand in hand with actually quite a rich cultural life in Gaza. I think of, you know, the brilliant Edward Said Music School. I think of the annual film festival that started 2 or 3 years ago in extremely difficult conditions. And it is just wrong to think of Gaza as a sort of simply a kind of economic basket case, though it is. It's also a civilization, and indeed a pretty ancient one. Just to give a little example, and I'm sure, as I say, I'm sure Ghada and Beth will talk more about the medical situation, but there are some brilliantly qualified and professional doctors in Gaza. Now, the UN says that Gaza needs, you know, another 1,000 doctors to get up to anything like capacity. And sadly, but very, very understandably, according to the health ministry, around 160 doctors have left in little more than a year. When I was last in Gaza in December, I'd hoped to be there around now, but it's impossible. I talked to one of them, one of the doctors at Shifa Hospital, a young, very bright young woman, 27 years old, called Sarah Al-Saka. And she talked absolutely agonizingly about the kind of decision that she had to make between caring for her Gaza patients and, you know, getting abroad in order to get a better life. And she was earning, by the way, $300 in every 40 days because of the salary cuts, and getting away for a better life and improving her skills. Now, it so happens that she's not going to leave her ailing mother, and I'm absolutely sure that if this thing spreads, which I really hope it doesn't, she'll be there working all the hours that God sends to care for the patients that may occur with, as you're going to hear, I think, pretty inadequate equipment. I think also of the very, very entrepreneurial spirit in Gaza, which has prevailed right through this extraordinary period. You know, at one end, there's the brilliant World Without Borders, which is a high-tech non-profit in which some of the, and I visited it again in December, which some of the brightest university graduates from Gaza are writing software for, you know, incredible Saudi customers who, and they make a living out of it. At the other end, I think of a young guy, 22 years old, Mohammed Abu Baid, who I found a year or so ago going through the rubbish for just a few shekels to get some plastic and aluminium cans that he could take to a local recycling plant. And he was the only earner in his family. And when I think, and I realize time is getting short, so I won't bang on for too long. When I think of whether coronavirus is really going to spread in Gaza, which, as I say, I think from, someone will correct me if I'm wrong, from the current 12 identified people who've got it. I think of very specific people. I think of fantastic waiters at the Manor House Hotel who administered first aid to me when I tripped over on the pavement round the corner in December because, of course, the lights were off. I haven't mentioned the fact that we're now at a situation in which there's 90% undrinkable water coming out of the taps and 8 hours on, 8 hours off electricity, which is better than it has been, but still a huge handicap for the population. I think of, the very poor people who always, when you go and visit them as a journalist, who always seem to magic up coffee or Fanta, and show incredible hospitality. I think of some of my friends, real friends like Mohammed and Miriam Faris, who have been running up to now. I'm pretty sure it's closed now because of the lockdown, which is adding to this hollowing out of the economy that I've already referred to. Desperate for clients it's no longer getting. Mohammed has leukemia, mercifully in remission, but I know they're going to be worried. And I think also, finally, of my great friend Faraz Akram, who is the Associated Press correspondent in Gaza, the bravest and brightest journalist I've ever come across. His father was killed by a random bomb from an F-16. He was then in his 40s. He'd been a judge in 2008-9. And just to finish on this note, I wrote to him just after the first two cases were identified in Gaza, and he wrote back to me apologizing for not having written earlier, saying, been working at home amid electricity outage and weak connections, but now I'm on track. And then saying that there were 10 cases, as I say, I think it's now 12, and the health ministry had encouraged people not to fret too much. And then he said, and this is so Gazan, thinking about the outside world beyond those walls, and also showing a kind of very Gazan spirit. I'm really thinking of you as the spread, the spread is viral there, meaning in London. Please keep well and keep assuring me. An extraordinarily unselfish point of view, I must say. Now I'm going to pass on overdue to.
And without any further delay, I'm gonna start with a quick overview of the situation in Gaza. And just a question, do you hear me? Is it great? Okay. So according to the Ministry of Health in Gaza, as you say, Donald, 12 cases were confirmed, and the healthcare system in Gaza tested until this moment or conducted examination for only 845 samples, which is a very low number, and it is mainly due to shortages in test kits in Gaza. And we believe that there might be more cases in Gaza, more than 12, but since the number of testing is very low, then this is the number until this moment. There are more than 3,000 people in quarantine in Gaza, whether in designated centers or at home isolation. And everyone who enters the strip, whether from Rafah crossing or from Erez crossing, are sent to quarantine. If I'm not wrong, since the beginning of March and mid-February, they had only 5 centers for quarantine, and now the number is 27, which is, a great thing, and it is due to a lot of efforts, because they understand in Gaza that due to the conditions and due to the density in the strip, it is better to send people to quarantine in centers and not to home isolation, especially those who showed symptoms when they entered the strip. The government in Gaza has took several preventive measures, closing universities, schools, mosques, and measures to limit the movement of people and to maintain social distancing. But everyone who is familiar with the situation in Gaza and specifically the state of the healthcare system knows that this is not enough. And when more cases will be confirmed in Gaza, the preventive measures won't be enough. And the question regarding whether the healthcare system in Gaza is prepared to handle the cases and to combat the coronavirus, the answer for this question is absolutely not. And to answer this question, I will address two issues. The first one is the state of the healthcare system in Gaza, and the second one is the public health conditions. And I will start with the public health conditions. And we're talking about poor public health conditions, especially poverty, density, the water, and the electricity crisis, which is mainly due to the closure imposed by Israel for more than a decade, and the repeated military attacks, which resulted in a large destruction in on health facilities and of infrastructure. So when we're talking about maintaining social distancing and practicing hygiene measures, I think it is quite hard to do this if we're talking about a highly populated place, more than 2 million people. We're talking about more than 70% of people living in refugee camps. And if there will be, more cases of coronavirus and the healthcare system in Gaza is not able to test everyone, then it will be difficult to track everyone. And with this, poor public health conditions, it will be very difficult to control the spread of the virus, unless the government will be able to track everyone who are tested and not to send them to home isolation. And we believe that with their limit capacity, this won't be attainable. The second thing is the state of the healthcare system in Gaza. We know that the healthcare system was collapsing even before the pandemic, where 1,000 of patients are referred to treatment outside of the strip every year for various treatments, whether complicated surgeries, a cardiology or oncology treatment, massive shortages in drugs, medications, and in medical devices. More than 40% of medications are unavailable in the strip, and due to restriction on the movement of medical staff, the healthcare system lacks many expertise. So now that we're talking about the pandemic, it is, we cannot um, we cannot expect the healthcare system in Gaza to be able to combat the spread of the virus if the healthcare system has been, struggling for more a decade to meet the needs of the local population. We understand that there are massive shortages in basic and in necessary supplies such as gloves, face masks, disinfectants, test kits, and of course ventilators and IC beds. In Gaza, there are only 65 ventilators, and some of them are being used by regular patients, and only 70 IC beds. The Minister of Health in Gaza has been calling since early March, for assistance, whether from the WHO or from an international organization. We know that the WHO, UNICEF, UNRWA sent some supplies, but it wasn't enough. Israel also transferred some test kits and disinfectants, but they did was mainly to facilitate the transfer of the needed supplies, whether from the PA or from the WHO, or even Arab countries such as Jordan that has been sending test kits and other drugs to treat the coronavirus patients. Yeah, what else? I still have some time. So I think that we do understand that without the needed and necessary assistance, the healthcare system in Gaza won't be able alone to handle the outbreak of the coronavirus, and there will be an outbreak because this is what is going on, worldwide. So there's no reason it won't happen in Gaza, and we think it's only a matter of time. If there will be more testing in the strip, and this will happen only if they will get the needed amount of test kits, then we're gonna see more cases. Moreover, one of the issues that we tend somehow to, not to address or to ignore because we're very busy with the coronavirus is the patients who are now in Gaza, and they can't leave the strip for treatments in the West Bank and in East Jerusalem and even Israeli hospitals because of the restrictions imposed whether by the government in Gaza or by Israel. And as I said, we're talking about thousands of patients every year that now cannot leave the strip. Only dozens of patients leave the strip every day for urgent treatments such as oncology treatment and complicated surgeries. So we're not talking only about the patients, the infected, people who will be needed, who will need to be treated for, the coronavirus, but we're talking about patients who need treatment and their treatment is unavailable in the strip, and in some stage they will also pose a burden on the healthcare system, and a solution should be, found for them, whether by letting them stay in hospitals in East Jerusalem and in Israel, or allowing drugs, medications, and medical devices that are unavailable in the Strip now. Yeah, I think this is it.
I'm Beth, and I'm the Director of International Relations at Gisha, based in Tel Aviv. Thank you very much to Yachad and the NIF for organising this, and also to Donald and Ghada for their very interesting presentations. So the basics, I think, have already been covered. Of course, the 12 coronavirus cases right now in Gaza, the fact that this is really a nightmare situation for the Gaza Strip as one of the most densely populated places in the world, where the majority of the population of 2 million are living in cramped refugee camps with high levels of poverty and food insecurity. I think it's really important to emphasize, as I think Donald did a bit in his introduction, that the situation in Gaza now with the coronavirus is far from new. Ever since Hamas took power over the Gaza Strip, Israel has used the pretext of security to impose extremely severe restrictions on the Strip and on its civilian population. And I think the coronavirus, not only in Gaza, but across societies across the world, has exposed existing vulnerabilities in those societies. And in the case of Gaza, this fragility, this vulnerability, is a man-made fragility that's been inflicted by decades of Israeli occupation. So the closure of Gaza has resulted in a humanitarian crisis whereby the Palestinian population of Gaza is routinely denied access to the most basic of provisions, to electricity, clean water, medical care, as Ghada discussed, and building materials as well for basic construction needs. We also have seen the Palestinian economy teetering on the verge of collapse, on and off for a number of years, partly in response to the holding of Palestinian tax and revenue money by the government of Israel. And that this has been particularly acute in Gaza, where we've seen astronomically high levels of unemployment, particularly among young people. And of course, Israel's policy of closing Gaza has also resulted in entrenching the division of Gaza from the West Bank, and the political divide between Fatah in the West Bank and Hamas in Gaza. There's a very kind of dangerous myth, which I think is something that the Israeli government particularly peddles, which is this idea that because Israel disengaged in 2005, it pulled its settlers out of Gaza and it pulled its army out, that it has no obligation to the people of Gaza. And this is one of Gisha's key messages before the coronavirus period, and will continue to be one of our key messages, which is that Israel needs to meet its long-standing obligations to the people of Gaza. And the coronavirus is an opportunity, I think, to push Israel to meet these very clear obligations that are set down in international law in the 4th Geneva Convention. But even leaving aside the question of international law, it's Israel continues to exercise control over the Gaza Strip, mostly via its control over movement and access to and from the Strip. And as a result of that control, Israel has responsibilities that arise from this. So I think this is an opportunity to push Israel to lift the closure of Gaza, to facilitate the free movement of goods during this time, and looking forward also to facilitate the free movement of people once this pandemic has subsided. So just to take a moment to look at the situation of movement and access in Gaza at the moment during the days of coronavirus. We've of course seen very limited movement across the occupied Palestinian territory, but this has become more acute in Gaza, as you might expect. So the crossings for goods in Gaza at the moment, the Kerem Shalom crossing into Israel and Salah al-Din into Egypt, remain open as it stands. At Kerem Shalom, we've seen that goods that are coming in from Israel and the rest of the world are being disinfected in line with Gaza Ministry of Health policy, but that's causing delays in their arrival to the Gaza market. The government of Israel has offered to expedite entry of some items that are usually restricted, but only where they relate to the coronavirus. In terms of movement of people, since the 23rd of March, Rafah crossing between Egypt and Gaza has been completely closed except for urgent medical cases. We've had reports that there are some Gaza residents who are waiting on the Egypt side and are being prevented from entering by the Egyptian authorities. The Erez crossing between Israel and Gaza is open only for returns of Gaza residents, except for in the case of urgent medical situations, for example, cancer. But as Ghada drew attention to, there's now a situation where there are people that have severe illnesses in Gaza that might have nothing to do with the coronavirus, but people are now opting actually not to leave the Strip to receive the treatment that they need because of the fear of contracting the coronavirus. So it's this kind of absurd situation where the healthcare infrastructure and resources have been run down to such a depleted state that people are actually having to leave in order to get access to medical care when they're already incredibly vulnerable. I won't go more into the healthcare now because I think that Ghada has covered that very well. There's an interesting point, I think, we've been hearing a lot about this, about whether there is indeed increased cooperation going on now between Israel, the Palestinian Authority and Hamas, and even some kind of positive noises about whether this is a basis for rekindling some kind of peace process, or whether this might be the basis for something more positive in the future. I think it's certainly true that we're seeing really unprecedented trilateral cooperation between the three parties due to this shared fear of the spillover of the virus, which of course knows no borders. And also the economic implications, which is something that Gisha is really focusing on at this time. So Israel has allowed the entry of critical supplies and equipment into Gaza since the beginning of the crisis. Israel, so COGAT, the authority that operates in the Palestinian territory, and the PA's Civil Affairs Department have created a joint communications mechanism for the coronavirus. So that's an example of quite unprecedented cooperation in dealing with the crisis. And then we've also seen some coordination between the PA in Ramallah and Hamas in Gaza. I think it's really important to be sensitive and aware of the fact that Israel has a particular agenda that it's trying to push in how it's presenting the interventions that it's made. So the Israeli authorities have been keen to put out a lot of messages about how they are facilitating humanitarian access for tests and so forth. It's interesting to note that Israel tends not to pay for the tests that are coming in. I think there were some that were donated by Israel, but broadly speaking, they're being donated by the international community at large, things coming from Qatar. Israel is still not taking responsibility for Gaza, whether financial or otherwise. Israel has very successfully, over a number of years, outsourced responsibility for Gaza to the Palestinian Authority. And we're now in a situation where the Palestinian Authority is in turn asking the international community for funding. And Israel is very keen to nurture this perception that it's acting in this very humanitarian way. As we've discussed, this is partly largely out of self-interest, and also a fear, I think, of the optics of what a serious outbreak in Gaza would look like for Israel, how the international community perceives such a terrible crisis. And we've seen situations now where UN officials like Mladenov, the UN Special Coordinator for the Middle East Peace Process, have actually been praising Israel for its coordination with the PA and with Hamas on the coronavirus. But I think we saw the depths of Israeli cynicism yesterday when Israel's Defense Minister Naftali Bennett suggested that Israel might actually condition aid to Gaza for the coronavirus on the return of the remains of Israeli soldiers who were killed during the 2014 war. So there is a huge amount of self-interest at stake here, I think. And I think Gisha's message really is that these kind of gestures of goodwill are not sufficient, and that Israel actually needs to acknowledge and carry out its obligation towards the residents of Gaza, this long-standing obligation that for so long Israel has rejected, neglected, and refused to fulfill. And that the ongoing comprehensive control that Israel continues to wield over countless aspects of life in Gaza comes with responsibilities towards its residents to protect basic rights and living conditions in the Strip, and that Israel's policy of closure, its occupation of Gaza, has left the Strip totally unprepared for a crisis of this magnitude. And that in turn means that Israel really has this obligation to protect the people of Gaza. And Gisha has some specific recommendations for Israel and also for the international community, but I'm happy to talk more in detail about that in questions if that helps with timekeeping.